Hello dear friends, welcome to my channel. So today we are going to discuss about a very important topic and also it is also a very small topic. So before going to explore this video, please subscribe to my channel. So today's topic is nothing but anatomical stroke box. So you might have seen that anatomical stroke box in your theory classes. Sometimes some people they are facing difficult to locate that anatomical stroke box. So how to locate this anatomical stroke box? Try to see, this is our hand, also this is our forearm, this is a flexor compartment of forearm, and this is our hand, palmar aspect of hand. Now I just turned it posteriorly. Here you can see the extensor compartment of forearm, and this is the dorsum of the hand. So how to identify the anatomical stroke box is, try to see the dorsum of the hand and also the lower aspect of our extensor compartment of forearm, and this is your wrist, and we are just trying to see the lateral aspect of our wrist. So lateral aspect of wrist, if you just extend your thumb, and just extending my thumb, and here you can identify the triangular shape depression. This triangular shape depression is nothing but the anatomical stroke box. Try to find out this triangular shape depression here. So this is nothing but your anatomical stroke box. So what about the boundaries of this anatomical stroke box? So in the anatomical position, this is medial and this is lateral, and this is apex, and this is your base. So medial boundary is formed by extensor pollicis longus tendon. Can you see the raised part? So this is formed by extensor pollicis longus tendon. This is forming the medial boundary. And what about the two tendons are forming the lateral boundary here? Two tendons are present inside. So the two tendons are abductor pollicis longus and extensor pollicis brevis. Abductor pollicis longus and extensor pollicis brevis. These are forming the lateral boundary. Medial boundary, extensor pollicis longus tendon. And this is the medial and lateral boundaries. Then what about the roof and the floor? So the roof is formed by, this is your roof, skin and superficial fascia. They are present they are forming the roof. In this roof we can identify the cephalic vein commencement. So cephalic vein first starts at this anatomical stroke box, then it is extending upwards and enters into the forearm. That is the first content of the roof of anatomical stroke box. Then other content is the other component of the roof is the superficial branch of radial nerve. Superficial branch of radial nerve, which is rolling over this extensor pollicis longus tendon and supplies to the lateral 3.5 fingers. Lateral 3.5 fingers, dorsum of the hand is supplied by this radial nerve. That is about the roof components. Then what about the floor components? Floor components are, so as you can see, this lower end of the radius is present, that is called a styloid process of the radius is present here, and then the base of first metacarpal, then we can identify the trapezium in the distal row carpal and the proximal row carpal, that is scaphoid, trapezium and the base of first metacarpal. These are the three bones and the lower end of the styloid process of the radius. So four bones, remember, these four bones are forming the floor of anatomical stroke box. Four bones are forming the anatomical stroke box. Then what about the content? Main content of this anatomical stroke box is the radial artery. So the radial artery, as we have seen in our previous class, the radial artery is extending into the lower aspect of our forearm laterally, then it is crossing the tendons, and below the tendons it is passing, and then in the anatomical stroke box it is appearing. Then after that it is crossing that extensor pollicis longus tendon and enters into the first dorsal interossei. So that is about the anatomical stroke box, my dear friends. Then what about the clinical aspects? So as I told you that roof component is the cephalic vein. So intravenous fluids we usually gives to this cephalic vein. And also other component is the tenderness. The tenderness of this anatomical stroke box says that there is a fracture is present in the scaphoid, or sometimes the trapezium bone fractures. So trapezium bone fractures and scaphoid fractures causes the tenderness in this anatomical stroke box. So that is about the anatomical stroke box. See you soon with a new class.